It was Jonathan Mann, director of the first global program on AIDS in 1987, who put human rights in the center of the global HIV response. This has been a challenge ever since, and is in particular now, since civil society is confronted with shrinking spaces caused by restrictive policies and populism.
The interviews demonstrate what human rights-based approaches are all about and what the HIV and global health movement would lose should we give up our core principles. We need a strong global fund and UNAIDS to secure that this won't happen.
Hi, my name is Jeffry Acaba, and I'm from the Philippines. Currently, I am based in Bangkok. Being someone who's also living with HIV and a TB survivor, also inspires me to be part of this work in making our lives, the lives of our communities better. When I say communities, I am pertaining to people living with HIV communities, TB survivor, and those affected by TB communities. I'm talking about key populations such as sex workers, people who use drugs, transgender people, gay men and other men who have sex with men, and most sex workers, and most especially young people from key populations. In the Philippines, at the moment, the group that is most left behind are the people who use drugs, mainly because of the president and the government's focus on the war on drugs, which really drives these particular populations underground. And they are getting killed, and they're being killed by the government in a systematic manner. But because of this war on drugs, the government decided to ignore that these populations exist. They don't even recognize them as human beings. And because of that, many of these people are getting arrested on a daily basis, and some of them are getting killed. Stigma and discrimination really impacts a lot, particularly around accessing health services, especially HIV-related and sexual and reproductive health-related services. Number one, if people are stigmatized and discriminated because of their sexual orientation or their gender identity, it's difficult for people to come out and come to the clinics and health facilities to access the needed services. For me, human rights-based approaches are approaches that respects, protects, and fulfill rights of everybody, regardless of who they are, who they love, where they are from. Putting human rights at the center of the response in HIV and how it impacts us in the Philippines is really very important. At the same time, having that human rights framework serves as a guide also, not only for governments, but also for civil society organizations on how we can facilitate and create programs that really address the fundamental needs of particular populations, especially the young key populations, and work around those needs to be able to make sure that we are addressing not only a particular disease, but also making sure that there's a level of quality of life that these populations experience. So in the political declaration on the universal health coverage, one of the provisions or one of the commitments is to make sure that member states commit to utilize or leverage the TRIPS flexibilities to make sure that there are available drugs at the country level, not only on HIV, but also in other related diseases. But we see in many countries in Asia and the Pacific that we are experiencing stockouts. I think the beauty of having the human rights declaration as a guiding framework in everything that we do globally really helps even countries, even organizations who are based in the Philippines, despite having this war on drugs situation. Because with these set of human rights principles, we can capitalize and make use of these rights. But having this global framework really helps in guiding the organizations that are working on the ground. Especially with this government right now, civil society organizations are seen as the enemy and are being demonized for making complaints and demanding the government of what they need. And that really jeopardizes the level of support that we receive as civil society organizations when we're supposed to demand and work with the government to better the health response. So the German government recently committed 1 billion euros to the Global Fund, which is a relatively good increase compared to their last pledge. So I hope that the German government, in every euro that they provide to the Global Fund, comes with a promise and a commitment and a demand to those countries who receive this funding to better the lives of people who are most marginalized and people who are criminalized in the country, such as in the Philippines. Ever since the Global Fund was established, it really changes the entire global health response narrative, because we are now saving more lives from dying of AIDS-related deaths. I see the German government as a prime example of how it continues to protect not only the democracies but also the rights of people, even those who are not Germans. And that's really very helpful.